South African health authorities, together with the WHO, have now launched a national action plan to fight fake and low-quality medical products. This first-of-a-kind initiative in Africa is bringing government, regulators and law enforcement together to make sure that medicines and health products are safe and effective. I see our polls pop back in there, and we'll share that with you later, because I'd love for you to listen to this interview and then interact with our poll. Have you ever been sold fake or substandard medicine? What can you do about it? Let's bring in WHO South Africa's Dr. Francis Magombo. Francis, good morning. Thank you very much for your time. We really do appreciate it. How big is this problem in terms of the proliferation of fake and poor quality medicines in our country?
Thank you for having me. In terms of how big this problem is, I think let's not just focus on South Africa. So I think let me first talk about how we define this problem. The fake and low-quality medicines, as you call them, we call them substandard and falsified medical products in our technical language. And this is a problem that exists not just in South Africa, but also globally and also basically within the continent of Africa. It doesn't respect any of the boundaries that we have set amongst our countries at all. This is a growing global threat, which basically undermines the safety, efficacy, and also the trust in the health systems. WHO estimates that in low and middle income countries, which South Africa is among those countries, 1 in 10 medical products is substandard and also falsified. So basically this contributes to treatment failures, adverse events, adverse outcomes, and also preventable mortality or preventable deaths among those that are sick. The challenges spans multiple sectors, as I can say them.
All right, let me pause you there, Dr. Francis, just for a second, because let's go back to those definitions. What are substandard medicines? And also, you talked about falsified medicines. What types of medication are we talking about?
So, substandard medicines normally, we would say these are medicines that there would be the medicines that but they would be of low quality, basically not having passed the quality measures that need to be there. In terms of falsified medicines, these are medicines that, although they may have the label of the actual proper medicines, they don't have the proper ingredients in them, so they are not really the medicines that you would think of them to be. Yeah. So basically, I think that's how I can define it in simple terms.
It's quite serious, because I think in the beginning you also talked about the impact that it has on treatment. You used the term treatment failures, and I think that's important for us to go back to. What types of medication are we talking about? Pardon me, is it across the board, or is it, particular types of medication that are being targeted for falsification or who have been made poorly?
Yeah, so in terms of what type of medicines, it's a broad spectrum of medicines, but we should also really look at the antimicrobial medicines like antibiotics or antiviral medicines. These are some of the drugs that are being targeted. But also, when you look at the way this business is going around, some of the medicines that are being targeted are not necessarily medicines. These are products that are basically inclusive of maybe weight loss products or maybe sexual enhancers, some skin bleaching agents as well. Including also corticosteroids. So these are some of the products also that are being targeted.
That's quite wide-ranging, Dr. Magombo. It sounds like anything from a painkiller to all the way, as you say, to antiviral meds and antibiotics, which you need that treatment. We know how serious it is when you are prescribed an antibiotic for an illness. So, who's doing this? Who's doing the counterfeiting? Who's doing the interventions that are rendering our medicines substandard?
Yeah, I think at this point in time, I think I shouldn't single out any of the or any of the people that are doing this, because I don't have that proper information. But I'm sure that colleagues in some sectors of the law enforcement and also national regulatory authorities like SAPRA would basically have some of this information. But what we know is that this is a big organized business that is also having its own network from across different borders. It's not just a localized problem, as I said earlier on. This is a problem that cuts across the global level of countries and also the continent of Africa, and even in the sub-Saharan, or maybe let me put that, the SADC region. These are some of the problems that we are having. Some of it is as a result of that the lack of adequate amount of medicines creates this market, because business people would want to profit from that lack of or stockouts of medicines and the like, and bring in their own products. So this is one of the issues I may point out. Thank you.
And we will definitely talk more to law enforcement, because, as you say, 1 in 10 in the South African example of medicines that are available there seem to have been tampered with in some way. The problem extends not only across the continent, but it is also a global problem. Very, very serious to understand how these networks are working and what information we do have. I think for our purposes, Dr. Magombo, a lot of people wouldn't even know that fake medicines exist. I mean, you go to a pharmacy and you get something, you expect the pharmacy or whoever's selling you that to have done their due diligence to make sure that the standards are happening. So the question is two-pronged. Are these medicines being sold from legitimate or respected or recognized establishments? And if I, as a patient, am going to get my meds, how on earth am I going to know this is potentially, a problem product?
Okay, thank you. So I think just one issue just to point out, the 1 in 10 I mentioned is not specific to South Africa. It's in low and middle income countries, basically globally. So in terms of where these medicines are being sold, I think there are many avenues. I think mostly it's outside the normal systems of selling the medications. Some of them are sold online, and some maybe also across the borders, and they find themselves in the informal sector, so as to say. So in terms of tracking or noticing whether this medicine is substandard or falsified, I think one of the things that you may know that it's like most of the medicines that we are buying from the pharmacies or we are getting from the hospitals or clinics, they would tend to have brand names or definition, packaging that is, we know very well. I think, for example, if you have chronic conditions and you're taking medications for a long time, you would know in terms of what sort of packaging this or labeling this your medication is. But when you find that the package that you have now is probably different or sounds or feels a bit awkward or not proper, you would want to try to find out whether it's actually the real thing or not. Basically, that's one of the things.
But how will we find
yeah.
out? And sorry to jump in there, Dr. Magombo, because that's an important point and we're almost out of time. Counterfeits are so good. That's the point. They mimic the packaging, and unless you really know the font might be different or where the label was placed might be different, it's very, very hard to tell. Even in the taste, I mean, you pop a pill, you swallow it down with water, and that's that. It's not like we're chewing on it necessarily. So it's concerning to me because it's going to be hard for the average person. If someone suspects something is wrong, how are they going to verify? Where do they go?
Okay. So SAPRA has got a reporting system where you can basically report to them if you suspect something is not normal or something is awkward. So they would guide you basically in terms of how to proceed. You'll find some of the reporting methods there on their website, but also SAPRA would tend to also investigate. When you make those reports, it's their duty now to investigate and also find out what's really going on.
All right, maybe to leave then, a final word on the National Action Plan, all right? Just quickly, how that plan is devised and a little bit more about the work and the agency and urgency in trying to get these medicines off the street and to heighten public awareness.
Yeah, okay. So this National Action Plan has got many sections which covers different areas. For example, the detection, the response, and also the prevention of these substandard and falsified medical products. So basically, the idea is that different entities, government entities, the private sector, and also civil society and the community should work together in terms of trying to prevent this sort of thing, and also in terms of detection and also in responding to it. So as part of this, the plan also talks about creating awareness to the public. So this awareness is not just to the public, but also in terms of healthcare professionals and other people who would be key in terms of identifying and also responding to this. So basically, I think that's what I can say.
Yeah, it doesn't imbue us with very much confidence, Dr. Magombo, and that's not your fault. It's the fault of the problem, I guess, that it is so widespread and it's also so disparate. It's got all of these different elements. It's got organized crime involved in it. It's got, who's selling and the packaging, who's enforcing the standards, who's doing the oversight. Let's just make it simple for our viewers, because if we look at our poll today and viewers being asked the question, have they ever been sold fake or substandard medicine, almost half of them are saying they simply do not know. They just don't know. So at the point, take us back to the point of purchase. First of all, as you say, the informal sector seems to be one of the problematic areas where you should not be buying medicine, right? So maybe go to who's regarded as a legitimate reseller. So that's the starting point. From that point on, if I'm buying, let's say, anywhere else, and not necessarily in the informal sector, what are the first two things, let's say, I have to do to, ease my concerns around whether my medicine is legitimate or not? Give us two practical things, Dr. Magombo.
Yeah, so I think for me, I would say that the first thing is that, one, you should have a prescription for your medicine. And also, secondly, you should be able to buy from a registered pharmacy. Then the chances are that those pharmacies will have products that are not substandard and are not falsified.
Yeah, but it doesn't resolve the problem, Dr. Magombo, of unprescribed medicine, right? Which you said, the medicine counterfeiting, substandard falsification is happening across the board. So that maybe will resolve the issue for prescriptions. And what about the other stuff that are unscheduled medicines?
Yeah, so I think for this one, yeah, you have got a point there. That's why the National Action Plan is talking about trying to make the public aware in terms of how to identify and also what to do when they find out that this is something that they are not comfortable about.
All right.